Hello to everybody and welcome to this new clinical webinar of the NIRVANA. My name is Federica Izzi. I'm a bioengineer and product manager of the BTS company. During this webinar, I will talk about the clinical experience of using NIRVANA system at the Infantile Rehabilitation Center of the FLENI Hospital in Buenos Aires, illustrating some clinical cases of stimulation, sensory integration, and motor training with the NIRVANA system. In particular, I'd like to thank the two doctors of FLENI hospitals who have prepared this presentation and give me the possibility to share with you today the contents that I'm going to illustrate. They are the Dr. Analia Suarez, she's a physiatrist, and the occupational therapist Evangelina Mourinho. So first of all, let's start with an introduction of the FLENI Institute in Argentina. The FLENI is a reference center for many professionals in the field of neuroscience known worldwide, which has been taking care of children and adults with neuromotor disorders for almost 60 years. There are two sites in the area of Buenos Aires, Belgrano and Escobar. In particular, in this webinar, I'm going to talk about the Escobar Center, where are located the Rehabilitation Center for Adults and Children that has opened since 2001 and today has about 70 beds. And they take care of diagnosis, treatment, and rehabilitation of patients basically from 0 to 18 years. And then in this site, there is also the Molecular Imaging Center. In the following presentation, I'm going to share with you the clinical experience at the Infantile Rehabilitation Center. At the Infantile Rehabilitation Center in FLENI Hospital, the NIRVANA system is used within the various programs that the center provides. In particular, they have the specific programs for motor rehabilitation, day hospital treatments where they treat patients with different problems which require not only a motor rehabilitation approach but also a cognitive rehabilitation treatments with a deep sensorial stimulation. And then they are focused on the various treatment during the hospitalization of patients who are in an acute phase after suffering traumatic injuries such as spinal cord injuries. When they use the virtual reality system, they work in a multidisciplinary team with kinesiologists, occupational therapists, and even the bioengineering group. At the FLENI, the NIRVANA is usually used in both configurations available, so the wall projection and the floor projection, on the basis of the patients in treatment. And the NIRVANA is used with the two main final aims: the motor rehabilitation of the lower and upper limbs, to promote the learning and motor control, and for the cognitive rehabilitation aim, using sensory scenarios that offer greater opportunities to promote the patient's movement. The approach that the center uses in their clinical practice is based on the Levin's principle of motor learning. You can find in the bottom the literature reference. For an effective motor learning of the patients during the rehabilitation treatment, it's important that there are High number of repetition of the exercises through meaningful activities. So the patient should be asked to perform functional tasks while he is performing the rehabilitative exercise. Then the progression of the difficulty level on the basis of the patient's residual capabilities. The patients should be asked to resolve more or less complex situation on the basis of the difficulty level, of course. Must be present a high level of motivation for a better performance, ensure a great amount of sensory feedback, and give to the patients the positive and also the negative feedback on his performing, because in this way he can get aware of the results of his movements and can get better and increase his autonomy level. A rehabilitative approach based on NIRVANA allows to follow these principles. With their years of clinical experience with NIRVANA in the FLENI hospitals, which begins in 2009, the FLENI defined a protocol of using NIRVANA, which is mainly based on these inclusion criteria. So the age, starting from 4 to 18 years, they started treating patients from 4 years, basically because they want to treat patients able to understand the various arousing stimuli. And up to 18 years, because this is the age limit of patients admitted to the infantile rehabilitation center. Then they focus on the diagnosis, because basically they treat children with cerebral palsy from the first level to the third level, who can move independently or with an assistive mobility devices. And they use the classification system based on gross motor function and the manual ability scales. And let's start seeing their clinical case. By using in practice these principles of motor learning, first of all, it's important to understand the right level of difficulty and start from this level at the beginning of the treatment. So they start with simple activities as shown in this example, and they work on the repetition of reaching activities, for example, to work on the displacement of the center of mass of the body and correct motor control while doing this task. The patients with the cerebral palsy usually show a backward shift of the center of mass. And working with this scenario, the patients they are looking for a positive center of mass displacement, because the patient is stimulated to move forward to activate the musical notes and listen to the sound feedback. Also considering that they are patients who generally need assistive mobility devices, most of their weight is on the upper limbs. So with these scenarios, they want to train the capability to load more on the lower limbs while controlling the whole body. And continuing to work on neuromotor development, increasing the level of difficulty, as we can see from this new video, they evaluate the lateral walk, which is for children one of the first motor tasks that is developed. What they figure out is that this lateral walk promotes the transfer of the body weight from one side to the other side on the frontal side, and stimulates the attention in the execution of the task, because having feedback on his movements gets the patient aware of the quality of his movement, and slowly he becomes able to improve his motor control, adjusting his performing. And in this exercise, the patient is required to move with his body in the four directions, so forward, backward, on the right or on the left, making these small steps. And with this scenario, they want to assess the child's ability to perform a compensating step that is necessary to guarantee the balance. Often, these compensating steps are not performed naturally in children with neuromotor deficits, so they use this exercise to stimulate the child to learn this motor compensatory strategy, with the final goal to increase the overall mobility, the movement initiation ability, and the degree of independence that should be the highest possible, of course. In this other example, they increase the level of difficulty while walking because they assess the change of direction during a zigzag path. They evaluate where the food is placed and how the child moves it. And this is a child with cerebral palsy, level 2, who walks with a stick, and even at the beginning he is excited by the desire to find out what happens in the virtual scenario, and he uses his stick to activate the string sound rather than walk. Then he learns the motor task to be performed with the help of the therapist, and he is stimulated to walk by controlling his body. These patients generally walk on the plane following straight directions, so the change of direction is very expensive for them, and it's not a very easy task. In following with the complexity of the exercise, they add the difficulty of high oculomotor coordination, because as you can see in this first video on your left, the child must be careful about where the mole to tap comes out, and should be also reactive to tap it quickly, because the mole remains available for a limited time. In this first video, at the beginning of the treatment, so the pre-treatment video, you can see the patients performing this exercise with several difficulties, okay? And he needs also the help of the therapist. But if I show you his performance after 2 weeks of treatment with the NIRVANA, so now you can see the video on your right, you can see how his level of autonomy in the execution of this task, the same task of tap the mole, is improved. And as you can note, the assistance of the therapist is no longer necessary. In this case, the doctors want to underline that the main aim of the whole clinical staff is to focus the patients in the visual attention of the environment, and not only on his body, because the child must be careful about where the mole comes from, locate it, finalize the movement, and coordinate all his body, and so his movements, performing this reaching task in a total safe level of autonomy. And we can discuss about the functional results viewing this video, because as you can see, this child at the beginning needed help for walking and used this walker assistive device with back support. But at the end of the 2 weeks treatment, in which the support was gradually eliminated, he could walk with the crutch. And what the doctor said me is that they want to add more quantitative assessment for the scientific community, and so they included also other measurements made, for example, with the wearable inertial sensor, very precise and easy to use sensor, that is the G-Walk. This sensor allows to calculate by simple test the spatio-temporal parameters and the pelvis kinematics during simple tasks like, for example, the walk task. And the aim is to assess the patients before and after treatment and to test the effectiveness of the following rehabilitation treatments. In particular, they used this 6-minute walking test to assess how the spatio-temporal parameters of the walk are modified with fatigue processes. And they also add measurement of heart rate and saturation to monitor also the cardiovascular system and see if the patient's abilities improve with the rehabilitation treatment. They also add the evaluation of the movement of the center pressure, the COP, with the portable baropodometry platform, the P-Walk. For example, during the execution of the exercise that we have seen at the beginning of the presentation, in a first static evaluation, they understand the patient's starting condition in standing still position. And after, in the dynamic session, they measure which are the COP displacement during the exercise execution. Now we are going to see how they use the NIRVANA system to improve the mobility of the upper limbs, showing the experience with some children who have motor difficulties and difficulties in interacting with the environment and with the people around them. The unique feature of the system is that it offers the child the possibility of making him aware of the movements he is performing, even if he has a very limited range of motion. At the first session, usually, the treatment of a child with NIRVANA begins leaving the patients free to interact with the scenario without constraining him to the execution of the exercise with a particular body segments, because it's important that the children get familiar and confident with the system and enjoy this immersive experience. In particular, they work on the motor initiative because they deal with patients with severe motor impairment and very short range of motion. And so they start with the global movements, unimanual or bimanual, to move on more complex movements, sequence of movements. And at the beginning, they simply evaluate if the patient is able to start the movement and with which limb, for example. And usually they want to stimulate the use of the impaired limb. They proceed with the grasp phases, because to facilitate the grip, they insert also additional therapeutic tools, so external objects like, for example, balls or arc, because for the therapists who use the system, it's very important that they can add other therapeutic tools, because with these additional tools they can increase the patient's stimulation. Then there is the oculomotor coordination, as the patients must follow the movement with the gaze and finalize it with the limb movement, upper or lower limb. And the patients must stop an object in motion, follow the trajectory, perform reaching exercise. And so in this kind of task, having a high level of visual motor coordination is really important. And as regards the strengthening, the system must allow to record and modify errors, positive scores, since the patients must learn from the repetition of the exercise, from various scenario of the same exercises, so introducing variables, and of course from his positive results. And as regards the coordination, we can say that they encourage a lot both bimanual and unimanual exercise, because they want to use both hands at the same time, and they want to work on the coordination of the upper and the lower limbs while performing an exercise. And from these images, we can see how the child becomes familiar with the virtual scenario, and so they start working on the coordination of the upper limbs performing the task with both right and left hands, or using additional therapeutic tools like in the water scenario and in the images that you can see in the bottom. And in this other example, we can see the coordination of the upper limbs in the task of reaching objects in specific position, which due to the motor deficits of these children is not so easy to achieve. If the patient has a unilateral limitation, we see how repeating the movement several times improves the proper strategy of hand movement. So for this reason, it is important to repeat always, also if the same exercise, but several times during the treatment. And the patients they treat don't have only motor limitations, but also cognitive disorders. And therefore, it's really important that the rehabilitation tool used is useful also for this purpose of cognitive rehabilitation. And in their experience, the NIRVANA is used as a complement to the conventional therapy, also for this purpose. Through the use of the system, in fact, they can understand if the patient is able to understand the cause-effect notion, that is, if there is initiation of the movement, and understanding that he is the protagonist of what is happening in the scenario. The provided audiovisual inputs allow to understand how much the patient receives them, what are the stimuli that stimulate him mostly. Then the problem solving involves a cognitive challenge, So it's important that the exercise has a target to be achieved, and the level of difficulty must be progressively increased based on the patient's abilities. They understand if the patient is able to think about the movements to perform and plan the execution of the movement. And as we can see with this new video, initially the exercise is shown to the patients as a multisensory environment and stimulation with different visual and sound stimuli. And they also add sometimes olfactory stimuli to see how the child reacts. And if he simple moves a foot, if he understands the cause-effect notion, if he interacts with the therapist, it's really important to give him all the time he needs to start with the treatment. And with this type of child, the therapist assistance is required. And initially, it's important that the therapist observes how she moves, how she responds, and if she understands that the movement of her hand, that is the cause, determines the activation and the sound of the trumpets, that is the effect. But always starting step by step. Therefore, in conclusion, at the Infantile Rehabilitation Center of the FLENI Institute, the NIRVANA is mainly used for the neurorehabilitation of children from 4 to 18 years with unilateral neurological deficits that require a global rehabilitative approach, motor and cognitive, and of the lower and upper limbs. The aim is that NIRVANA is used as an additional therapeutic aid added to the conventional rehabilitation, and it can stimulate the patient's motivation, which is one of the most important factors for the success of the entire rehabilitation process. In their clinical experience, the biggest advantage of the system is the possibility to personalize the treatment using the imagination and the experience, of course, of their multidisciplinary team. And so the occupational therapist, the psychologist, the kinesiologist, and they work a lot as a great team. And they appreciate a lot that the same exercise can be used for different purposes. Above all, because not all patients are the same and can be treated in the same way. So I really want to thank the FLENI Center team again for sharing with us their NIRVANA clinical experience and giving us this interesting material. Thanks a lot to all the participants for the kind attention during this webinar, and see you soon in the next webinar.